I feel like I'm back home whenever I'm here at the Alex Panton Foundation. It's really funny how time flies. It seems like it's just been a couple of years. It's hard to imagine that it's been 8 years. I'd like to thank all of you for being here. The show of support in terms of numbers is very encouraging to those of us in the mental health community, and we really want to give our heartfelt thanks to all of you for being here. Ladies and gentlemen, I'd like you to imagine a child, bright, full of potential, eager to learn and explore. Now imagine that same child carrying an invisible weight, a burden they never chose. It could be the echoes of trauma, the silent struggles of anxiety, or the overwhelming fog of depression. These battles are often fought alone, unseen by the world around them. Mental health is not a luxury. It is not an afterthought. It is the foundation upon which a young person builds their future. Yet, far too many of our children and adolescents are struggling in silence. Their pain dismissed as just a phase or hidden behind a brave smile. The truth is, trauma, whether from adversity, neglect, loss, or unseen pressures, leaves lasting imprints on young minds. But here's what I want us to remember. Trauma is not a destiny. With the right support, the right interventions, and the right understanding, healing is possible. Today, ladies and gentlemen, we're here not just to talk about the challenges, as the governor said and others, but to illuminate a way forward, a path built on awareness, compassion, and action. Because when we prioritize our youth and their mental health, we don't just change individual lives, we change the future. The challenge is for us to participate, for us to become involved, for us to make an impact, and there are ways to do that. So let's move forward. We're going to talk about where we're coming from, some of the progress achieved, and there's been quite a bit, where we are now with some of our challenges, and turning the tide moving forward. So let's go back 80-something years to a sleepy little village community with about 6,000 to 7,000 people called the Cayman Islands. The Colonial Register, which was the informational aspect of the British Foreign Office, would compile information on all the territories and all the different parts of the British Empire. And there's some wonderful information about our wonderful islands in the Colonial Registry. I highlighted on this screen some of the information there taken in 1943, where it was highlighted that the islands, quote, suffered greatly from a lack of facilities. There was not a lot to do. The men were at sea for the most part. The women had to tend to the family. The children entertained themselves outside of school and church. And there were not a lot of community activities. For many times, there were periods where things would ebb and flow. So, for example, from 1939 to 1946, activities were limited because, again, most of the men were either merchant marine sailors or some went off to Trinidad to join with the Caribbean militia that went to the UK. and fought and helped to defend Britain and the world in World War II. And a lot of the organizations that had been recently formed, like the Girls Guides, the Boy Scouts, and so on, were without their leadership. But it's interesting to note that after World War II, as the men were coming home and the world was starting to revive, we were smart enough, and our forefathers were smart enough, and mothers, to put in certain activities. So it's interesting to note that there was a Girls' Guild Church of Scotland that had a festival of youth in December 1947. In 1950, the Girls' Guild had a carnival. And this was a realization early on that we needed to bring young people together. Two major points realized 80-something years ago: that young people need to socialize and have connectivity, and that the community recognized that this had to be done by bringing them together in different types of events. One thing that was very clear and illuminating throughout this time was that our mental health patients were sent overseas, were sent to Jamaica. And the Colonial Registry highlighted that fact by saying that the mentally ill were sent to Jamaica and the cost was borne by us, by the Cayman Islands, to pay for that. There was no specific facility for the mental health, or for those the mentally ill, I should say. And that set a pattern that has continued to very recently. One of the challenges that we faced as a very small group of islands was having the appropriate facilities to deal with complex presentations like the seriously mentally ill. Unfortunately, not everyone could send family members to Jamaica. Remember that earlier slide I showed, we didn't even have electricity. We didn't have airplanes. There were boats that took those that could afford it from the Cayman Islands to Jamaica for certain treatment. And there was a large segment of the population that had challenges and had to take care of their family members, hide them, keep them at home, do the best that we could to take care of them. Those that became unusually aggressive or violent as a result of serious mental illness were housed in the prisons. So it was an infamous amount of information, or there have been an infamous amount of information about the Georgetown police lockup, the West Bay lockup at the time, that were called the cages. And they were called that because the temperatures in those environments could get to be over 100 degrees. And it was tantamount to almost torture. Those cells and locations were not fit for human treatment or a place for humans to be, let alone to have children or adolescents there. And there were many cases of young people who had behavioral issues that were kept in those conditions. In 2016, the RCIPS replaced those types of facilities, and that was one step forward. We've had lots of other progress through the years, and I'd like to underscore that every single government of the Cayman Islands, where while we may have criticized some of them for not maybe being as active and as proactive and as aggressive as we'd want moving forward with mental health, every single one made steps. There have been quite a few changes. Starting in 2001, with the Bradley and Palmer report, which was a group of professionals that were brought down by the ministry at that time to look at our mental health law and to start to change and modernize that law. A report was prepared in 2002, and although it took many years to implement many of those recommendations, they eventually were implemented with a new Mental Health Act, which has been updated and even by our previous minister has been tweaked to apply to the 21st century. We've had workshops. We've had a 8-bed ward that was finally opened in 2003 at the Health Services Authority. And for the first time, we were able to treat people with mental health challenges separately from the medical ward in the hospital. And more importantly, pull away from using the quote-unquote cages as a place to treat people with serious mental illness. Progress has continued with multiple legal and social type changes with the establishment of a mental health commission and the mental health laws, a disability policy. As I said earlier, the custody suites being opened so that those that were agitated or that had a forensic or criminal component to their serious mental illness were treated more humanely. We had the formation of the first nonprofit organization dedicated just to mental health issues and primarily to youth, and that's the Alex Panton Foundation. Loud Silent Voices, our group home in West Bay, was opened in 2021. And then we've had other changes like the Alex's Place, the Adolescent Mental Health Hub, that has significantly, and it's still in its early stages, significantly impacted a lot of the stats and information that you're hearing, with young people feeling that at least there's more hope and there are places for them to go. We'll talk a little bit shortly about what recently happened in 2024 with the Inspire Youth Speak Up event that has been presented on. And not to forget, in December of last year, the opening of the Ponciana Rehabilitation Center, and we'll touch on that shortly. Now, where we are now, as I said, we've made significant progress, but we still have a way to go, and we need your help. We are developing our child and adolescent mental health services. Alex, his place being the crown jewel in that system formulation at this point. But as you heard earlier, Alex's Place is not open 24 hours a day. It does close in the evening, and we need to move towards having that facility open 24 hours a day. We need to move towards having our hotlines and emergency type services for the youth 24 hours a day. So that's going to require resources, finances, and collaboration, not just with government, but with the private sector. A quick note, Alex's Place is a collaborative effort. We used to throw that word around quite a bit, and I think recently we're actually enacting it and not just using it as a word, and realizing that we are not going to achieve things as a country doing it in silos or government alone managing things. Ladies and gentlemen, we're in a new world right now. Politics aside, who we want to side with or not, we are in a new world. We are in a world where for at least the next 20 years, we're going to have to be self-sufficient. We're going to have to be careful about how much of our money we are sending to other countries to take care of our own people. We have an 11-bed unit at the hospital. We have 11 beds, as we speak, acute psychiatric beds for almost 100,000 people. Those 11 beds, as I speak at this very moment, are taking care of a 12-year-old child. There are a few 13-year-olds, a 15-year-old. We have 40-year-old men. We have a gentleman that was in the news, so there's nothing confidential about it, that was found not guilty by reason of insanity, and he's in the same place with a 12-year-old child. One issue that we need to be clear about is we need to educate all of you in here that are picking up bits and pieces of information. Take it out there and let's educate the powers that be about mental health. Mental health does not fit in one basket. Recently, I heard discussions about and confusion about criminality or using Ponciana and maybe separating a part of it for the criminally insane, or I'm going to be sarcastic for a moment. We have a challenge in the Cayman Islands in terms of the numbers of spaces for children coming into the school system, 4, 5, and 6-year-olds. If I was to propose to you today that we have space at John Gray High School, that we could maybe take some 5 and 6-year-olds and put them in John Gray High School because we have space there. We could fence off an area, carve out a little play area so that the 6-year-olds can play and the 16 and 17-year-olds can be on the other side. I don't think I would get much traction with that. Mental health, I'm biased, but I'm going to say, I feel is a little bit above physical health. And yes, I said it. Yes, I said it. Why? Because if you don't have mental health, if you can't think, if you can't take the medications that the physical doctor gives you, if you can't show up to get your physical therapy, if you can't take the treatment that you're supposed to be given because you can't process it, your physical health isn't going anywhere. Again, because of time, I want to move forward. So what we do know, ladies and gentlemen, and this is from a psychologist that I'd encourage you to look up if you can. His name was Kurt Lewin. He said, the best way to understand something is try to change it. And that's when many times we figure out and learn things. Mental health impact on youth is significant. It's significant. 50% of all lifetime cases of mental health challenges begin by age 14 and 75% by age 24. Mental health primarily is an issue of the youth and young people. Yes, it continues into life, but that's where we need to put our focus really in terms of preventing it from getting to the point where we need to use all the beds at Ponciana. 50% of students with untreated mental health issues drop out from school. And we already know about the stats about suicide and the significant impact that that has on families, on lives, and the incidence among young people. The brain is undergoing radical change during adolescence. So young people, again, are at a period in time when they take chances, when they are risk-taking, when their executive functioning or ability to discern danger is much less than where we all are at our ages. So it is a critical time when we need to take advantage of in terms of making our interventions. We heard a lot today about adverse childhood events or experiences, and that is one of the core areas that we're focusing on now and realizing, just as Dr. Bassan said, that while we know biology plays a role, and as a psychiatrist I know that very well, that we can inherit certain traits, we can have an inherited predisposition to anxiety or depression or schizophrenia. Our social structure, the social determinants, where we live, what we hear, who is around us, what is being done around us and to us, plays a major part on how those symptoms or predisposition become manifested. No different than somebody that has diabetes in their family and you're told that you need to lose a certain amount of weight, you need to manage what you eat, you need to have better choices, and then that can help to keep the disease, the significance of the disease at bay. We know that these adverse events disrupt brain development. It increases the risk of multiple mental health disorders and substance abuse. It increases the risk of other challenges. But we know that there is hope. There is hope, and we're seeing the benefits of change every day. One thing I wanted to highlight today also is there's a belief many times when we hear about these adverse childhood events that the most dramatic aspects of it are the ones that have the greatest toll. So physical abuse, sexual abuse, which are abhorrent, traumatic, extremely challenging and frightening, many times are viewed as really that's what adverse childhood events are about. Ladies and gentlemen, what we're seeing at Alex's place, at the hospital, in other settings, in private settings, are that the impact of divorce, and that takes in a large percentage, the impact of divorce has changes on family dynamics. It creates a certain amount of fear in many young people, not all. It is a vulnerable time, and it is considered for many a trauma, even if it's manageable. I'm not being hard on us because most of us, or a large percentage of us in this room, have some contact with that, whether we ourselves have been divorced or children of parents who have been divorced or have a close family member or friend. Substance abuse in the home is a significant impact on our children. Having a relative that's incarcerated creates a significant burden because there's a socioeconomic impact on the family and on that child. And that starts a pattern of them missing school maybe, not being able to keep up with peers, even when their problems are identified, having a single parent so they're not able to make their appointments and follow through with treatment or see their therapist. So these other types of ACEs, the hidden ACEs, are extremely significant, and the stats that we saw earlier highlighted that. We are turning the tide, though. We are turning the tide. As I said earlier, we have a lot to do. There's still a lot to be done, but we've made progress. While we focus on ACEs, I want to put this out, and I guess we could call it PACEs, but there are positive childhood experiences also. I don't want us to feel helpless in here. There's a lot of body of information and work that shows that providing children with nurturing relationships, safe environments, supportive communities help to build resiliency. There's a lot of work at the University of Stanford in California about the concept of belonging. Belonging. It's a basic human need. It's what drives us as human beings to feel that we need to be in groups. It's why all of us are here when we heard that the Alex Panton Foundation is having their annual meeting. And you see this turnout in here because every last one of you in here has some connection to mental health and feel and know it's important. And that has caused us to join together in groups. And that's been the history of mankind. That's what differentiates us from other animals. There's an interesting part to the Stanford study about belonging, and that they had actually 2 questions asked. Do you feel that you belong to your school environment, and do you feel that you belong to your home environment? Take that away. Ask a child or evaluate in those 2 areas, and children and young people that feel connected at home or in their home environment and connected in their school environments do the best. Those that are less on either one of those scales have more challenges. You saw a little bit about the Inspire Youth Meet Up and Speak Out. A little background about this. How did this start? A lot of us are humble in here, and a lot of the presenters. This was truly a collaborative effort. Things can work. Government, private sector, the public sector, volunteers, private organizations can come together and make a difference. This all started. First, I want to give a shout out and support to my colleagues, the psychiatrists that are in the Cayman Islands. I think there are about 6 of us or so. We're the ones that are on the front lines of emergency psychiatric care, along with our CPNs, our community psychiatric nurses, who I also want to give a shout out to today. We're the ones that do on-calls. So anything goes on right now in the Cayman Islands from a psychiatric perspective, and somebody's taken to the hospital, it's the psychiatrist that's called to assess the situation and move forward. We were noting high levels of self-injurious behavior, of suicidal ideation, as some of the stats showed earlier. And it was troubling because we also noted that there had been several completed suicides of young people last year. There was a period between May and July where we had 2 in a row. In June of 2024, a young man named Jordan McDonald wrote into CMR on an editorial. And Jordan said in a letter to the editor that he felt no one was listening. He felt that young people were dying and suffering, and no one was paying attention. That young man, along with what we were seeing on the emergency side of things, triggered a discussion, a major discussion that started at the HSA, among the doctors and the psychologists. We reached out to our CEO, Ms. Lizette Yearwood, that has a tremendous passion for mental health, and that's been a part of Alex Panton Foundation. Lizette got on the phone, reached out to the ministry, explained the situation. We had talks with the ministry, the chief medical officer, the chief nursing officer, the deputy chief officers in the ministry reached out. They came to the hospital. We sat down and had meetings about things. We brainstormed. We looked at what was done in other jurisdictions, what would fit in with us, and realized that there is a concept called a youth summit. And it's been done in Australia, in Canada, in other countries. In the UK it's done, where you want to empower the young people. It's one thing for us to talk here. It's one thing for me as a psychiatrist to be giving a talk and a lecture and saying what should be done or how things should be done. But it's another thing to listen to the youth, to hear them. And what we've been hearing anecdotally for years are them saying several things. We don't feel like anybody really pays attention to us or listens to us. Some of that actually came out of an Alex Panton Foundation meeting. I think it was maybe 5 years ago in at the beginning of the pandemic where the Alex Panton youth ambassadors were saying that they don't feel that they can participate in anything. I think it was our previous premier that was the first premier ever to invite young people into a cabinet office and show them what was going on and say, these are the workings, this is your future, this is your country. We need to do more of that. We need to include them. So out of that concept came Inspire. It was a resounding success. You see all the information gathered from that. 244 young people. And it was brought together quickly. It was brought together very quickly. We didn't have 6 months to plan. Just imagine if we're able to do this. And we do not need to necessarily do it on this scale. It could be done with 50 young people. So this is very powerful. This is something that gave us and has given us a treasure trove of information to move forward. And more importantly, I feel, because we can gather information in different ways, it has empowered young people. It makes them feel that we are listening. Now it's very important what we do with this information moving forward. So I don't want to spend too much time. I think I'm going over, but the benefits of group gatherings, we know, as we said, it contributes quite a bit. We know that the desire to belong is a fundamental part of human nature. That's how countries are developed. That's how we've made progress. That's what differentiates us as human beings. We need to continue to involve our young people in activities to meet up. Early on, as I said, the first slide, going back into the 1940s, the old Caymanians realized that we had to do something for our young people. We had festivals or fairs to bring them together so that they could share and talk, and that could build strength. Action steps. Our ability to work together is what fosters our survival and success, and we need to continue to build on that. Collaboration is extremely important, and I'm begging you, please, bring the private sector in. Just look at the sponsors of this wonderful Alex Panton Foundation. Look at how many organizations have contributed. I'm begging the next elected members of government, please, and we're not stepping on the civil service. I will commend the civil service when they do things right, and I'll criticize them when they don't. I don't care. It's our money. It's our money. It's our money. We're not tearing down our country because I wouldn't want to be anywhere else. We're not tearing down our country. We need to build it up. And as I said earlier, we're entering new times, ladies and gentlemen. We need to prepare our children. There's something called AI that's going to take away a lot of jobs. We need to prepare them in terms of the types of careers they choose. We need to listen to them. Another quick thing, we know that we need to talk to our children. And we've always been hearing that through the years, like talk to your child, talk to them, keep them close to you. We now know with the information that we have that talk is the umbrella. To be more specific, we need to listen to them. And we need to listen with what an old psychoanalyst said, listening with the third ear. Not just listening to what they say, but listening to what they don't say. Observing what they do and don't do. Remember that the information that they are getting is much, much more than what we are able to even decipher and process. I can go on and on, ladies and gentlemen, but thank you for having me. Bless all of you.